Almost all child deaths in low-income countries are caused by three very dangerous illnesses: pneumonia, which is a serious chest infection, diarrhoea, which is loose stools, and malaria, which is caught from mosquito bites. This film will help you understand when your child is very ill and in need of urgent medical attention. Here's our expert to explain more.
Children of all ages are at risk of severe illness which can lead to death. If you notice any of the following signs, you must immediately take your child to a health worker. The signs that you need to look for are difficulty in breathing, no interest in drinking or breastfeeding, vomiting, a dry mouth and cracked lips, very high or very low temperature. For example, does your child feel much hotter or colder than normal? Pale skin, blue lips, irritable or upset behavior, unusual sleeping patterns, unconsciousness, which is when your child cannot be woken up, fitting, or violent shaking of the body and limbs or arms and legs.
My baby had blue lips and I didn't know that this is a problem. The community health worker told me to go to the hospital.
My daughter didn't do breastfeed. It was unusual for her, but I didn't know it was dangerous.
If your child has any of these signs, you must immediately take them to a health worker. And remember, even if you think your child is ill, then you must keep giving her fluids such as breast milk or other safe fluids like cooled boiled water. If she feels cold, wrap her so she is warm. But if she feels very hot, don't wrap her at all.
So now we understand the signs of serious ill health in the child. We're ready to learn more about malaria, a dangerous disease that's caught from mosquito bites.
If your child has a fever, take them to the health post at once. Fever may be caused by lots of different infections, including malaria. Malaria can become very severe in less than 1 day. If this happens, your child is at risk of death. She may have fits. This is when a child shakes without control and becomes unconscious, which is when the child cannot be woken up. To see if your child needs to be taken to a health post with suspected malaria, firstly check if the child is very hot, has unusual pale skin, tongue or gums, yellow whites of the eyes. They may also have joint pains. If your child has any of these, then she could have malaria or another serious infection. You should go to the health center for a blood test which will confirm the illness and where they can give you medicine to start urgent treatment. You should also check to see if your child has a cough, difficulty breathing, diarrhea, tiredness, sickness, a stiff neck, or a low appetite. If you see any of these symptoms, it could mean your child has a very severe malaria or possibly another serious illness as well as malaria. Your child may also need other treatment and might need to go to a larger health center or hospital.
My daughter was tired all the time. This means she had a malaria or anemia. I have to take her to hospital.
My child have a fever which coming and going. I knew that it could be a malaria and it can be treated easily.
So now we know the signs and symptoms of malaria. Now our expert is going to tell us how to treat it.
If your child has any of the general warning signs mentioned in the beginning of the film, or has a stiff neck, or has a fever for more than 7 days, then she has a very severe disease with fever. Take her to a health post straight away. If you can, Quickly find a health worker who will give your child a malaria medicine whilst you're on the way to the nearest health post. They may also give you another medicine called antibiotics to make your child better alongside paracetamol to help the fever. But you must still go to the nearest health post as quickly as possible.
As we've said before, malaria is a very common and life-threatening illness, so let's hear how to avoid catching it.
Malaria mosquitoes grow in standing water, so don't let water stand in containers like old tin cans or other rubbish that can collect rainwater. Use insecticide-treated nets. These need to be treated and repaired every year or they won't work. Understand how to properly use mosquito nets. Use anti-mosquito sprays in the home. Tuck the net under the bedding so mosquitoes can't get through and place over the child every night.
So now we know how to check for the symptoms of malaria, how to treat the condition, and most importantly, how to prevent getting it in the first place. With all this information, we should be able to keep our children in good health.